Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron nang umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not a either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae that is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
But I really wanted to share yung poem from Chadao. So 100 years from now, it will not matter what my bank account was, the sort of house I live in, or the kind of car I drove, but the world made the difference because I was important in the life of a child.
Good morning, everyone. We are from Simply Nature, and that is Tito Shen, and I'm Tita Jesslyn.
Jesus loves me.
Jesus loves me.
For our gratitude, Stersha.
Ha? Ito na ba ang mga sundalo ng Israelita? Maliit man ako sa iyong paningin, malaki ang aking Diyos. Tutulungan ako ng aking Diyos at lalabanan kita at tatalunin kita.
Nayanig ang paligid sa pagbagsak ni Goliath.
Si Mother Ricky, pasalamatan naman natin si Mother Ricky at palakpakan din natin siya kahit siya ay nasa ibang lugar ngayon.
Paano kayo di gagaling, di ba?
Pinupurit, sinasamba kita.
And Lord, we believe you for testimony from every child in this place. In Jesus' name we pray. And all God's people say, Amen! Hallelujah!
Nung 2022 po, yung parang inipon ko talagang pera pambili nung Simply Nature, nung vials, ng PPARS. Yun po yung iniinom ko.
Cancer lang siya, strong tayo. Kaya patuloy lang po tayong lumaban kasi may Panginoon tayong gumagabay sa atin lagi. Yun lang.
And on behalf of the Simply Nature team, God bless you all. Maraming salamat for blessing us this day. We hope that we have made you all happy. God bless you once again. Here in Simply Nature, we are always with you from start to healing. Thank you, everybody.
CA markers.
Mataas siya. Then, nung after 3 months, nung pag-take ko ng Simply Nature, doon, naging normal na siya until now. Kahit si Dr. Johan na gulat siya kasi biglang normal agad. In just 3 months, nag-normal agad yung CEA ko. 1 year and 5 months. Cancer-free. Dapat may food supplements kayo. Like Simply Nature na proven and tested ko na. Talagang hindi ako pwedeng mawala ng Simply Nature na yan.
2019, I was being diagnosed a cancer of my uterus. So I was shocked. Sabi ko, bakit nagkaroon ako ng ganito? Samantalang hindi ako mahilig sa pagkain. I'm sorry, basura. Started the tablet and then the powder. Tinry ko din yung yung tawag dito.
Gel?
Yeah, yung gel. Yes. It's really good. After 2 months ng aking therapy and taking PPARS, sabi ni doktora, magpa-laboratory ka na. So, nung nagpa-laboratory na ako, praise God, 2 weeks ago or 3 weeks ago, lahat normal. To God be the glory. Salamat sa Diyos. Sa 2 months ko po ng aking pag-take ng PPARS, ako po ay cancer-free.
Welcome to another episode of Simply Healed. We have with us tonight again Dr. Jansen Calalan.
Hello, Sean. Hello, everyone. Happy to be here again.
This is the third video that of a series where we talk about immunotherapy. And here we specifically talking about drug-based immunotherapy, not natural immunotherapy. and specifically we talk about our ICI, immune checkpoint inhibitors. So for all the patients who are undergoing or considering to undergo the immunotherapy, ICI immunotherapy, these 3 episodes will be very useful for your understanding. So today, Doc, we're gonna go on the basics. We covered a little about this on the first series.
Yes.
So now we're like sort of revisiting it and giving it a bit more depth. I think, Doc, that's an excellent strategy by you because if we hear it again, you're like, oh, I remember this, and now I understand better. So, Doc, without further ado, let's go and jump into our topic. How does immunotherapy work in the first place? So that goes back down to our own immune system. Right?
Yes. So first, for us to be able to understand what immunotherapy is, we have to understand how the immune system fights cancer cells. Okay? So first off, when a cancer cell happens, okay, when there are cancer cells, okay, how does the immune system detect it? So we have something what we call antigen-presenting cells, which are also known as dendritic cells.
Oh, that's what I always talk about. PPARs increases dendritic cell activity. So PPAR activates the pathways that make your immune system detect the cancer cell.
Correct. Okay. So when the dendritic cell detects the cancer cell, so it gets a bit of the cancer cell, okay, a piece of the cancer cell. Then it presents it to the immune system.
Okay.
Specifically the T cells. Now, when the T cells receive this antigen from the dendritic cell, okay, it becomes activated.
Oh, okay.
Okay.
Yeah.
Now, I am activated. I will become a warrior. I will become a berserker. Then go on
a rampage.
Yeah, go on a rampage. When I'm activated, then of course the blood circulates, right? The lymphatic circulates. Now, when the T cells go to the tumor, okay, now the T cells are able to kill the cancer cells. Okay, so basically this is how the immune system detects and fights off tumor cells. Now, what if the cancer cells evade detection of the immune system?
Then it's as good as your immune system not working.
Yes.
And that is why cancer tumors grow, right? Because tumors shouldn't exist. Your whole immune system is to prevent tumors from existing in your body. So the cancer cells have a sort of like a security pass that allows, a gate pass that allows them to travel without restriction.
Yes. There are a number of situations where we might suspect that this is happening. So number one is you have undergone chemotherapy, radiation therapy, you have had surgery, then the cancer recurred. Or you did not respond to the chemotherapy, the radiation therapy. Okay? Those are one of the possibilities. Also, another possibility would be you've had cancer. You just have cancer. Okay? It's because your immune system was not able to kill off the tumor cells.
And why?
And grow. Yeah.
Because your immune system couldn't recognize the cancer cells. Yeah. So Doc, basically, if the immune system can recognize the cancer cell, it will kill the cancer cell.
Yes, exactly. So how does cancer cells evade the immune system? Okay, so there are certain cancer cells which express what we call as PD-L1. So PD-L1 is programmed cell death ligand 1. Okay, so remember, this receptor is expressed by the tumor cells. This is the security pass of the tumor cells.
Oh, that's the security pass.
Security pass, okay? Right. Now, on the other side, so your immune system, the T cells, okay, what do they have in order for them to detect? Okay, this one does not have PD-L1, I will go and kill. This one that does not have security pass, I will go and kill. Okay, so the T cells have what we call as PD-1.
Okay.
The PD-1 is their detector.
Okay.
Now, when the T cells and the tumor cells interact, okay, so when they interact and the tumor cell shows the T cells, this is my security pass. T cells will now
scan it, verify. Okay.
Okay, you're one
clear.
of us. You're clear.
Oh wow, that's why your cancer cell survives in your body.
Yes. So we now have what we call as an immune checkpoint inhibitor.
That's why the word checkpoint.
Yes,
you know,
the word checkpoint.
It's like the police checkpoint.
Exactly,
Yes.
exactly.
Okay.
So the immune checkpoint inhibitor, this molecule attaches on the T cell or on the tumor cell to block that interaction.
Oh,
Okay,
so you either block the scanner so that no matter what it scans is the enemy,
yes,
or
you equip the
okay, I got it. Let me give an analogy. You either put a blindfold on your soldier so that he attacks everything, okay, or you use something to block the security pass of the cancer so that his security is invalid.
is invalidated.
Yeah, he
okay?
gets attacked.
Now
Okay.
he gets attacked. Okay, so this is basically how this specific immunotherapy works.
Yeah, it's so simple to understand now. Wow, it's very interesting. All the different things that we talk about from many episodes for the last 2 years makes a lot of sense when you just explain this part. So now, Doc, all the supplements that are on TV that tell us improve your immune system. They could be making your warriors strong, but your immune system is still totally useless.
Yeah.
Because the one thing that you want your immune system to improve doesn't happen with most supplements out there. It doesn't improve the detection.
Yes, exactly. So that's why a lot of natural supplements, although there are evidence that, let's say for example, turmeric, there are a lot of evidence that turmeric works against cancer cells. But how come
You can eat all the turmeric?
You can eat all the turmeric and your
Okay.
cancer nothing happens, still nothing happens because of this mechanism. And there are patients actually where you give them turmeric and cancer disappears. So, I mean, how do you reconcile that?
Yes.
It's because of this.
And here's the good news, okay? I'm the PPAR expert here. So PPARs is able to increase the dendritic cell activity, which allows the detection of the cancer. So if you've been eating turmeric and nothing's been happening, take PPARs and then you'll see the turmeric start to work because it's the mechanism that we're talking about. Wow, thank you so much.
So next, let's move on to what are the medications. No?
Yeah, what are some of the drugs you will be taking if you are going to go?
There are a lot of different drugs which are immune checkpoint inhibitors, no? But these are the most common ones. So number one will be pembrolizumab or your Keytruda, nivolumab or Opdivo, and atezolizumab. So pembrolizumab is mainly used for triple-negative breast cancer cells. Triple-negative breast cancer,
okay,
and hepatocellular carcinoma, but it's most studied in melanoma.
Okay.
Atezolizumab is for liver cancer.
Oh, that's important.
Yes. For atezolizumab, it's usually given in combination with another molecule. Okay, but we won't go into that already. Now, next one is nivolumab. Nivolumab is used for non-small cell lung cancer, head and neck cancers, and renal cell carcinoma. Okay.
Doc, we talked about how immunotherapy is the next wave of cancer treatment. In many ways, less harmful than chemotherapy. But there are still side effects
Yes, that's true. That's true.
for immunotherapy.
Yes.
What are some of these important side effects?
Now, before we go into some of the side effects, let's compare this to chemotherapy.
Okay, that's great.
Okay, so for chemotherapy, we all know how bad it can get because your immune system goes down, your blood cells goes down, everything goes down, even your hair goes down. Okay, so for immunotherapy, the side effects are much milder.
Okay, that's
but they are still there. Okay, the difference is the more common side effects for chemotherapy is hematologic or blood side effects.
All right.
Okay, immune system, white blood cell goes down, you become anemic. You have you can have bleeding side effects. You can have gastrointestinal side effects. For immunotherapy, the blood side effects is actually rarer.
Oh,
it's much rare.
All right.
So in immunotherapy, it's very important that your immune system does not go down or it does not become suppressed.
Yes, which is why it's important to notice that if you're going for immunotherapy, very oftentimes you're first prescribed chemotherapy. So it's so important that you protect yourself during the chemotherapy process, so that when you move to your next phase of immunotherapy, your immunotherapy will work. This is where I would really encourage you, right, to go for a consult with Dr. Jansen, where he has protocols that will help you protect your system while it's undergoing its chemotherapy. because the immunotherapy is actually much more expensive than the chemotherapy. So it's like really sayang or a waste of your resources if your chemotherapy hampers or diminishes the more expensive immunotherapy that comes after it. So what you can do is you gotta have an appointment with Dr. Jansen. Go and have an appointment with Dr. Jansen so that he can protect your immune system from the damages of chemotherapy, so that when you start using your more expensive immunotherapy, you have the maximum impact. Now, as to why you have to go for chemotherapy, even though it might compromise your immunotherapy, that's for another video, because that's another long discussion. But of course, your uncles have very good reason why you go for chemo first, then immunotherapy, even though you do compromise your immunotherapy with the chemotherapy.
Okay. So, in order for us to understand the side effects of immunotherapy, we have to understand first on how it works in the first place. So, let's review. How does immune checkpoint inhibitor work?
Security pass.
Security pass. Now, it's not just the tumor cells that shows the security pass or the PDL1 receptor. There are also host organ systems that express this security pass, so that your immune system does not attack your own organ or attack
that is true.
Your own body.
Because the T cells, the warrior cells, the moment they get activated, they run all over your body. They don't they circulate in your bloodstream.
They circulate. Yep.
So they could be end up attacking everything. So that means your body must issue security pass to all the other organs.
The healthy organs, the normal organs.
So so that your gangster, enraged berserker immune systems don't attack them.
Yes.
So if you disable the security pass, you end up
attacking your own.
So an immunotherapy side effect, very different from chemotherapy. Chemotherapy, because it bombards the system and it damages the blood cells. This one, you have a chance that your own immune system attacks
your own body.
So the side effect, the possible side effects of immunotherapy is autoimmune disease.
Correct.
Which is like lupus. Lupus is when your own immune system attacks your healthy cells, right? That's what lupus is. So since you disable the security pass, there's a chance your own immune system starts attacking your healthy cells.
Exactly, correct. So the main side effect of immunotherapy is autoimmune diseases. Now, we have a number of ways on how we can manage autoimmune diseases, but we're going into that later. First, let's describe first what are the different side effects specific to different organ systems. So this image shows you the different organ systems and the different diseases associated with immune checkpoint inhibitor therapy. Then there are more common side effects and the rarer side effects, as shown here in this table. So the more common side effects in immune checkpoint inhibitor would be gastrointestinal, endocrine, and dermatologic. So there are a lot, but I won't discuss them all. So we focus on the more common ones. So gastrointestinal, like your nausea, vomiting, diarrhea, you can still experience those together with with chemotherapy. So they are similar in that aspect. However, chemotherapy does not have endocrine side effects. Immune checkpoint inhibitor therapy has endocrine side effects, specifically hormonal imbalances, hypophysitis, so that's suppressing the function of your pituitary gland, thyroid dysfunction. So with this respect, you can actually experience symptoms of hyperthyroidism and symptoms of hypothyroidism. Okay, so it's very important for your doctor. If you experience these symptoms, it's very important to follow up with your doctor. Also, dermatologic side effects like rash, itching, vitiligo,
I think that's
white spots.
A simple reaction of your immune system attacking your skin.
It's
right?
like allergic reactions.
Yes, like eczema, psoriasis.
Yes, it's very similar.
It's an autoimmune response.
And dermatologic side effects are the most common ones. So if you are someone who's receiving immune checkpoint inhibitor therapy and you experience these side effects, especially you have rashes, please go and follow up with your doctor. So because you might be experiencing a possible allergic reaction. Okay? And the rarer ones, so like your neurologic, cardiac, pulmonary, hematologic. So here, hematologic is rare in immune checkpoint inhibitor therapy, although it can still happen. nephrologic, like your kidney, your immune system attacking the kidney, musculoskeletal, and ophthalmic, your eyes. Now, there are actually a lot of things that can make the toxicity more enhanced or more pronounced. So, what are these? For gastrointestinal toxicity, okay, please avoid taking antibiotics at least 2 months prior to the start of your immune checkpoint inhibitor therapy, because this can affect progression-free survival and overall survival. So it has been shown that if you take antibiotics within 2 months of starting immune checkpoint inhibitor therapy, then the period of time wherein you are in remission shortens.
Wow.
And your lifespan decreases. Overall survival.
Wow.
Okay? So, please take note of that. For kidney toxicity, please avoid taking NSAIDs. So, NSAIDs would be like your ibuprofen, mefenamic acid, diclofenac, dextroprofen. Okay, so these NSAIDs, okay? So, avoid taking those. Avoid taking antacids as well, like your omeprazole, pantoprazole, esomeprazole.
Wow.
Okay? Because these can heighten or make the immune checkpoint inhibitor therapy more toxic to your kidneys. For pulmonary toxicity, asthma, COPD, and previous history of receiving radiation to the chest or to the chest area, no? These things can make the side effect of immune checkpoint inhibitor therapy to the lungs more pronounced.
Doc, when you share all this, I hope for our audience and for myself, I'm so impacted in the sense that we always we downplay how much your general health affects your cancer treatment. Because Doc, you talk about taking antibiotics. If you take antibiotics before going for your ICI treatment, your remission, basically your lifespan actually drops. But why would you need to take antibiotics in the first place?
Yes.
Right? Because you have other comorbidities, because you have your own immune system is weak and you got another infection, not cancer,
exactly.
Right? So it really highlights that all these factors that will create side effects in your treatment comes from general health, right? So it's so important that cancer patients also know how to prepare themselves before you start your treatments, that you don't ignore the other general health issues in your body. They compound or basically they make it even more complex to treat your cancer, and some of them have a direct negative impact on your cancer treatment. So again, I want to encourage you, engage Dr. Jansen to support you through your oncological protocols. Go for a consult with him. He's worked with so many patients and they're doing so well now with their chemotherapy, immunotherapy. And it's really wonderful. If you work with a nutritionist won't be able to explain how ICI works. That's why you want to make sure your doctor that's supporting you through all these protocols understand these protocols, which is why I like it. I love working with Dr. Jansen, because even though he does the lifestyle medicine support, he knows so much and is literally so well versed in the actual protocols oncologists go through. So I will encourage everyone. You can come to our AMA, ask me anything, which is coming up soon. But really, go for a one-on-one so that you can get real support through your entire treatment process. All right. So Doc, since we're talking about how to manage adverse effects of ICI, how do we manage the adverse side effects of ICI?
Okay, so management of the side effects of immunotherapy would be very similar to how we manage autoimmune diseases.
Makes sense.
So number one, of course, is supportive treatment. Okay, so whatever the patient experiences, whatever symptom the patient experiences, we prescribe medications, we prescribe lifestyle prescription to address that specific symptom. Also, steroid therapy is a mainstay. So why is it steroid therapy? Because it's steroid therapy.
Antihistamine,
immunosuppressant, and antihistamine.
I hope everything is clicking in your mind now, right? Autoimmune disease, steroids used to suppress is antihistamine.
Antihistamine, anti-inflammatory medication. So these things. So aside from steroid therapy, we also have immunomodulatory therapy drugs like your DMARDs drugs, your PPAR therapy, and other procedures that manages the immune system. Okay?
So, Doc, for you, you're actually using natural PPAR therapy.
Yes.
Your
yes,
PPAR
yes.
therapy is based on, as much as possible, instead of drugs, is
Natural,
the foods that you
the
eat.
food that you eat. Okay. Now, there are groups of people where we cannot give immunotherapy. Okay.
That's important to know. And give the audience just one guess. I'm sure you can guess because you understand now, right? The groups of people that cannot use ICI therapy are patients who have autoimmune diseases.
Correct.
Because the side effect of ICI is autoimmune diseases. And of course, based on that, there's another group of people, Doc.
Yeah. Those who have received organ transplant.
Because your organ transplant is considered to be a foreign body,
So,
and if your immune system doesn't recognize any of the security pass, it's gonna attack it, and that makes it worse.
Okay. So now we answer the question that we've asked in the previous episode. Why is it that a plant-based diet is so good for immunotherapy?
Yep.
Yeah, it's because a plant-based diet can really make your immunity more hostile to cancer cells, to bacteria, to viruses. It makes it work properly. It makes it work effectively. Okay.
It basically makes your fighting soldiers in your immune system stronger,
Yes.
fiercer. And
Yes.
now that the key way the ICI works is to remove the security pass, you just want these fierce fighters
to just kill off the cancer. Okay? This is especially useful for more advanced cancers. Okay? Like stage 4 cancers, cancer recurrences, immune checkpoint inhibitor would be more effective in these groups of people. I'll give you an example. Dostarlimab is a very recently tested ICI therapy against colorectal cancer. So the patients, colorectal cancer patients, stage 4, nothing can be done anymore. They received Dostarlimab. All of them went into remission.
Wow.
100%.
100% cure rate.
So it's really wonderful on how these drugs can really work in amazing ways.
But Doc, it really also amazes me that all these drugs did was just to expose the cancer.
Yes,
which
expose the
means
cancer.
the
Yeah.
thing that kills the cancer
your body.
is
It's
more
your body.
effective than chemotherapy,
Yes.
more effective than anything. It's already in your body.
It's already in you.
It's already in you.
Now, with the side effects of immune checkpoint inhibitors, right? So we have autoimmune diseases. It's the same. A plant-based diet is so good, no? It's so high in antioxidants, so high in anti-inflammatory nutrients that, it can nullify the side effects of immune checkpoint inhibitors. Why? Autoimmune diseases. Those patients who have autoimmune diseases.
Yeah.
The dietary pattern that they undergo where we see the most remissions is a plant-based diet.
So
Okay? So the plant-based diet is the answer to the side effects of immune checkpoint inhibitor as well. Okay?
So not only does it boost the effect of the immunotherapy, it manages the side effects of the immunotherapy.
Yes. Correct.
So there you go. I see many questions are coming up, Doc. I just want to wrap up before we go into our AMA, which is that immunotherapy works by mainly disabling the security pass that allows the cancer to go undetected. And the case that Dr. Jansen just brought up, the 100% effectiveness on even late-stage colorectal cancer, the killing power is actually in your own immune system. All the immunotherapy did was to disable the security pass. So that goes to show all of us that there are many things that we can do to increase the killing power of our immune system, from antioxidants to so many lowering inflammation and all of that, right? Doc, thank you for that wonderful explanation. Now we understand how ICI therapy works, and we know that we can do so much to make it work even better and what to avoid. Yeah, I see the questions are coming in, so without further ado, let's proceed to our Ask Me Anything segment.
Good evening, everybody. My name is Jenile, and you are watching another episode of Simply Healed webinar brought to you by Simply Nature. I hope you were enlightened in our topic for tonight, entitled A New Way of Treating Cancer Immune Checkpoint Inhibitors. And we are now in what we call AMA, or Ask Me Anything portion. Now, to answer all your questions for tonight, I'd like to call our lifestyle medicine specialist, Dr. Jansen Calalan. Good evening, Doc.
Good evening, Jen. Hello, everybody. Good evening. I hope you learned a lot with our lecture tonight. So, immune checkpoint inhibitor therapy is really a new way on treating cancer. No? So, a lot of the immune checkpoint inhibitors right now are still on trial, but there are a few who have already passed clinical trials and are really being used or utilized by the oncologists, no, to treat cancer. And we've seen quite a number of success already. Okay? Yeah.
And you know, Doc, sayang Sir Sean couldn't make it tonight as he has prior commitments. So we miss you, Sir Sean. And Happy Chinese New Year to everyone. I'd like to recognize our avid viewers, starting off with Miss Lily from Malaysia. Welcome. And okay, so let's go to the first question coming from Ukaini. I want to listen here so I know or I have an idea because my husband was diagnosed with colon cancer. So, any comments, Doc?
Yeah, well, it's good that you are doing your own research and trying to learn as much as you can, no? So, yeah, I hope this webinar of ours helped a lot. And I encourage you to follow Simply Nature's Facebook page, my personal Facebook page as well, so you can get you'll be updated on our future webinars. Okay, so you can continue on learning.
It's actually connected to our second question from Naida, which is, where is your clinic, Doc?
So my clinic is, I think they flashed it several times during the lecture, so you can just go back and pause the video, do a replay, and so you can see. Okay, so basically, I do virtual consults and face-to-face consults. No, but for the face-to-face consults, I do it in Centuria Medical Makati. I only go there if I have a patient. So please, if you are really interested to go for a consult, in person, you would want me to see you personally, then please send us a message and set an appointment so we can schedule your consult. If you prefer to, if Centuria Medical Makati is too far from your place, rest assured we can still do the consult. You can do it online. Okay?
Yes, so for those of you who wish to have a consult with Dr. Jansen Calalan, the link to schedule an appointment is in the description box or comment section below. Our pretty healthcare specialist Beth will reach out to you shortly. Moving on to the third question from Mr. Julius Carino. Is it okay that we shift from PPAR's agonist in powder form to PPAR's plus tablets?
Okay, it depends, no? I suggest for you to go for a consult first so I can know where you are in your treatment right now. If you have cancer, I need to know the stage. Have you underwent procedures before, chemotherapy or radiation therapy perhaps, or whatever treatment, no? Then from there, I can gauge, no, if it's the right time for you to downgrade your treatment to just the tablets. But for now, please continue on the powder first until you've made the consult. Okay.
Okay, so before we go to the next question, let me also recognize one of our avid viewers, Miss Lilibet from the Philippines. Welcome, Ma'am. Thank you for joining tonight. Okay, next question from Ma'am Louise. What's the safest NSAID to take for chronic pain?
Safest NSAID to take for chronic pain? So actually a very good question. However, the problem there is, okay, this is how I escalate the pain NSAID therapy for pain management. So if paracetamol is not working anymore, I immediately go to mefenamic acid or ibuprofen. But more often than not, it's mefenamic acid. The reason why is it so? It's just because I find mefenamic acid to be much more potent when it comes to the response of the patient. However, you should not be on mefenamic acid for a very long time, okay? Because NSAIDs in general, so not just ibuprofen, not just mefenamic acid, not just diclofenac and the others, they increase your risk of developing gastric perforation or stomach perforation, okay? It irritates the, it thins out the inner lining of your stomach, okay? And that increases your risk for developing ulcers, then eventually later on stomach perforations, okay? So you should not be on any NSAIDs for a very long period of time, okay? So, yeah, that would be my answer to you. But of course, the choice of NSAID would ultimately boil down to whether or not if it's effective for you or not. So if you're still feeling pain and you're already taking NSAIDs, I think it might be prudent to change your medication. So to know the appropriate medication for you, please go for a consult, okay?
Okay. Moving on to the next question from Miss Naida. My friends undergo mammogram last month and a benign tumor was seen at the areolar area. So should she undergo operation or not?
Okay, it depends, no? For me, if it is not huge, if the mass is not huge, you just have to monitor. Just make sure it doesn't grow. Make sure that there are no skin changes, there's no nipple discharge. Okay, so those are the things that you have to watch out for. Okay, when would be the right time to have it removed? If it increases in size rapidly. Okay, so in order to know, you have to undergo regular breast ultrasound and usually every 6 months. No, since it's benign, every 6 months would be fine. And the annual mammogram. Okay. Yeah.
Okay, Doc, that's actually connected to our next question. What are the surveillance scans I should do right after breast cancer surgery?
Okay, right after breast cancer surgery, number one imaging study that you should go for is your bone scan. Okay, bone scintigraphy. Okay, that is very important because we really want to rule out metastasis. Okay, especially to your bones. Another one would be chest CT scan to rule out lung metastasis. Okay, and of course, in order to evaluate the surgical area, no, so the area where the breast was removed. Okay, another one would be, but I think this one would be for a much later date. No, usually doctors request for this after 6 months, no, post treatment. So it's your PET CT scan. So the PET CT scan is a more comprehensive imaging study. So PET CT scans usually scans the whole body, no, and try to look for any hypermetabolic areas in your body that is avid, no, or FDG avid. So that's the medical term for if that part of your body is has a higher metabolism than the others. Okay, but this is an entire topic in and of its own. But okay, so yeah, after 6 months, more or less, that's the appropriate time to undergo PET CT scan. Okay, so yeah, so those are the imaging studies that you need to undergo once you have finished breast surgery. Okay.
Okay, Doc. And another related question from Ms. Dang. I have breast cancer, stage 2A, done mastectomy, and ongoing chemo now. So, how PPARs can help my case?
Okay, if you're undergoing chemotherapy right now, try to assess, no, do you have any side effects related to chemotherapy? Those side effects can be addressed by your PPAR therapy. Okay, it can be lessened, but not totally eliminated, no. Just lessen. Also, PPAR agonists can also make your protecting the bone marrow from the chemotherapy, because usually chemotherapy side effects is it's toxic to the bone marrow. So what happens is after the chemotherapy, your blood cell counts will go down. So PPAR agonists, especially simplynature PPARs liquid, can help protect your bone marrow so that your blood cell counts won't go down as much. Okay, so it's very important to prepare your body for the next cycle of chemotherapy. Okay, it's really very important because when you're undergoing such treatments, interruptions can affect your risk of recurrence, your risk of overall survival as well, no? In your progression-free survival. Okay, so those are the things that you have to watch out for. And yeah, you can of course try simplynature PPAR agonist for when you're undergoing chemotherapy. Just message us and go for a consult so that I can prescribe you the appropriate protocol. Okay.
Yes, speaking, Doc, of chemo side effects, no, how can we counteract the tingling of arms where IV chemo is inserted?
Okay, that's a very common side effect. Okay, usually what I give is vitamin B complex, some medications to reduce the tingling sensation. Okay, so yeah, again, in order for me to make the appropriate recommendations, please go for a consult. Okay, but those are just some tips that you can immediately do. Okay.
Okay, so I have another question sent privately from my client, Miss Nini. This one is about oral chemo tablet side effects. So one of the effects are increased osteoporosis. What would you suggest to counteract this effect?
Okay, osteoporosis. Okay, this is not only for those who are undergoing therapy with this medication. No, this goes to all women. Okay, would be, later on when you get old, you'll feel the risk of developing osteoporosis already. Okay, so number one is you have to build your bones early on. Okay, as early as possible. So how do you build bones? Okay, bones harden when we put stress on it. Okay, so when you lift weights, weight-bearing exercises can help build bones. If you are physically active, it would help build. Would help build bones. No, well, although if you are undergoing such or doing exercises, no, or undergoing doing exercises, you're very physically active. Please make sure that you're also eating the right kind of food and the right amount of food. Okay, so what foods would help build bones? Foods which are high in calcium. Okay, so these would be your soy products like your tofu. Number two, green leafy vegetables. Okay, dairy is not. Okay, contrary to popular belief and to what the commercials are advertising. No, dairy doesn't help build bones. Okay, in fact, countries which have a very high consumption of dairy also have very high rates of osteoporosis. So see the irony. Okay, and in countries where we see very low consumption of dairy, we see very low rates of fracture risk or very low rates of osteoporosis. So yeah, so avoid dairy. So this would apply also if you are undergoing medications that increases your risk for osteoporosis. Okay, so if you're taking these medications, you have to exercise as much as possible and as soon as you can. Okay.
Okay. Follow up to her question. So does taking PPARs reduce the osteoporosis effect of oral chemo tablet?
It does not. It does not. However, there is a medication to help build bones, no, which is called denosumab. Denosumab and PPAR agonists work synergistically. So PPAR agonists can make the bone building ability of denosumab much more effective. Okay? Yeah. Why? It's because PPAR agonists help cellular differentiation, or in other terms, cell maturation. Okay, so there you go.
Thank you, Doc. Next question coming from Miss Lilibet of Philippines. what is the best diet for people who have cancer? And can you recommend top 3 peanut butter brands?
Okay. Wow. Top 3 peanut butter brands, Okay, so the best diet for patients who have cancer is still a whole food plant-based diet. So a whole food plant-based diet is a diet that is centered around fruits, vegetables, whole grains, and legumes. So legumes will be your beans, nuts, and seeds. Okay? So a whole food plant-based diet only revolves around those foods. Okay? And you should not be eating any food that is sourced from animals. Okay? That would be your red meat, your processed meat, your white meat like your chicken, your fish, your seafood, eggs, and dairy. Because why? Because animal protein increases IGF-1. So IGF-1 is a growth factor inside our body that just tells everything inside you to grow, even cancer. Okay? Animal protein can increase that substance. So please, if you have cancer, or you are trying to prevent cancer, or if you have, or if you are already in remission, avoid animal protein or animal food products as much as you can. Okay? Now, for the second question, my top 3 peanut butter brands would be, well, this is local, okay? This is for the Philippines, so because I live in the Philippines. Okay, so my number 1 choice would be Lily's Classic. Then Crunchy Skippies. Skippies, no? That with the crunchy variant. Okay? So it's the peanut butter that still have
Whole
nut
peanut.
crunch, the whole peanuts, the crushed peanuts.
Crushed peanuts.
Yeah. And number 3 would be your Peter Pan brand. Okay? Yeah. This is not in any way sponsored by those brands, okay?
Okay. Moving on to the next question from Ms. Malu. How PPARs can help me as a DCIS patient without any treatment except for monitoring?
Okay, if you are, okay, first for everyone's information, no? What is DCIS? So DCIS stands for ductal carcinoma in situ. So ductal carcinoma in situ is a Latin word for, well, ductal carcinoma is a type of breast cancer. A pathologic subtype of breast cancer, no? So ductal carcinoma. In situ means is that it's still what's the proper term? It's not inside. It still has a shell. Okay, in situ. It's in situ means inside. Okay, or within. Okay, so it still hasn't breached the basement membrane. The basement membrane is a membrane that separates the. How do I explain this in a layman's term? Okay, wait. Okay. Okay. This is the simplest term, that simplest analogy that I can make up right now. Okay. So ductal carcinoma in situ is a type of breast cancer that hasn't invaded yet. Okay, it hasn't invaded. Okay, so it's still confined. Okay, so PPAR agonists can help make your immune system more hostile to cancer cells. So it can help. Actually, ductal carcinoma in situ is you can still reverse this naturally without needing any conventional intervention or surgery, no. But yeah. So the way to reverse this is, number 1, to eat properly. Number 2, make your immune system more hostile to the cancer cells. And number 3, you have to do regular physical activity. Okay, so those are the things that you have to do. But to be more guided, because I have to know other details, no, whether or not this would be the appropriate path for you, please go for a consult. This is very important, okay? Because if you know that you have ductal carcinoma in situ, okay, this is essentially a stage 0 breast cancer. Okay, it's early. It's really very early detection. Okay, and if breast cancer is really detected very early on, it has a very good prognosis. Okay.
Wow, that's a heavy question. Before we move on to the next question, I'd like to say a special shout out to my client, Mr. Rami Ramirez. Thank you for watching tonight. Okay. Oh, okay. Okay, moving on. A question from Miss Lina. Hello, good evening po, Doc. What is best to eat who have breast cancer 3B after 5 years? Like, can they eat animal products now since they already passed their 5-year remission?
I would still not recommend for you to do so because you have breast cancer stage 3B. Now, it's very important. Okay, so breast cancer stage 3B is a really very advanced stage, no? So, congratulations to you since you're still, you've really won the battle against cancer since you're still alive, no? After 5 years and alive and kicking, no? And I believe you have a very good quality of life, no? So, yeah, I would still advise against eating animal food products. I would encourage you to go whole food plant-based, just so that you reduce the risk of recurrence as much as possible, as much as you can. Okay? Yeah. Okay.
Okay, thank you, Doc. Okay. Next question coming from Miss Rowena. Good evening po, Doc. I was diagnosed with endometrial grade 2, stage 1C2. Okay, so before I start my 6th session in chemo, I already have in my lungs and it didn't go away. It even grew from 0.5 to 0.9. Now I'm under chemo again, paclitaxel. It's best chemo meds for my lungs. This is my 4th session tomorrow for lungs. What are the foods that I should avoid? And what can I do so I could recover faster? I really want to live longer. Thank you, Doc.
Okay, so foods that are really very important would be the foods that I have mentioned, no? Whole food plant-based. So fruits, vegetables, whole grains, legumes, legumes like beans, nuts, and seeds, no? Right on, one tip, no, would be broccoli. Broccoli is really very good for lung cancer, but there are other foods that have anti-cancer properties. I cannot mention them here because there's so many. Okay, I think it would be better if you go for a consult so I can make the appropriate recommendations as well. Okay, and yeah. Also, aside from foods, no, you also need to exercise. Begin physical activity. Okay? Yeah.
Okay. So, thank you, Doc. For those of you who wish to have a consult with Dr. Jansen Calalan, the link to schedule an appointment is in the description box or comment section down below. So, or you can just type in the comment section how to consult, and my fellow customer relations officer, Ma'am Sheila, or healthcare specialist vet will reach out to you shortly. Okay. Moving on to the next question. Very far from the cancers. How PPARs helps patient with hypertension? This is coming from Serbian. And hypertension, atherosclerosis, and heart enlargement.
Yeah, okay, very good question. Actually, PPAR agonists works at a very fundamental level. No? It works at a genetic level. So, if it affects the gene, it affects a lot of pathways. Okay, so yes, although our topic for tonight is about cancer, no? Yeah, PPAR agonists can also help patients who have hypertension, atherosclerosis, and heart enlargement. Okay, now how can PPARs help these conditions? So number one is PPAR agonist is a very powerful anti-inflammatory properties. So by just reducing inflammation, you already help reduce the inflammation in your blood vessel. So if your blood vessels are not inflamed, then it would be very elastic, very pliable. So this would help your hypertension. Okay. However, we still have to find out the root cause of why you are hypertensive in the first place. Because if you're hypertensive because you lack sleep, then PPARs will not help. Okay, because you lack sleep. It's sleep that you need. Okay. If you are quite stressed, well, stress. The symptoms of stress, PPAR agonists can help. However, the reason or the root cause of your stress, external, your environment, perhaps a person that you're stressed with, so those things have to be addressed. Okay, in order to reduce your stress so that your hypertension will go away. However, if the reason of your hypertension is because of inflammation, then PPAR agonists can definitely help. Now, inflammation, we're talking about inflammation. If your blood vessel gets inflamed, you increase your risk of developing atherosclerosis. Okay? This is in combination with an elevated cholesterol, no? Because if your cholesterol is low enough, like less than 150, even if you have very high inflammation inside your body, you will not form atherosclerosis. Okay? It's also the same, no? If you have very high cholesterol levels, but the inflammation inside your body is really very, very low, your risk of developing atherosclerosis is also quite low. So those two should go hand in hand. Now for heart enlargement, the reason, again, we have to find out the reason why your heart is enlarged in the first place. If the reason why your heart is enlarged in the first place is because of your hypertension, then if the reason of your hypertension is inflammation, okay, or eating a lot of junk foods, okay, then PPAR agonist can help. However, here's the thing. For heart enlargement, once your heart enlarges, okay, it is very difficult to reverse it. Okay? Very difficult. More often than not, it will not go back to how it was before already. Okay? Yeah. So that would be my answer to your question, Bien.
Thank you, Doc. Okay. Next question. Can immunotherapy still help an immune deficiency patient?
No. Okay. Immunotherapy, you cannot give them to an immunodeficient patient. Okay? Because the immunotherapy will not work optimally because the context or the prerequisite for for the immunotherapy to work well is a functioning immune system. So if your immune system is or you're immunosuppressed or you're immunodeficient already in the first place, then we have to find other treatment modalities for you. Or if an immune checkpoint inhibitor is really one therapy that would give you a very good outcome, then it's really very important to make sure your immune system is functioning well first before you undergo immunotherapy. Okay?
Thank you, Doc. Next question coming from Sir Raul. Is stem cell therapy considered immunotherapy?
No, stem cell therapy is different. No, so stem cells. No, by the word stem cells, stem cells are cells that can evolve into different types of cells. So a stem cell can become a blood cell, it can become a nerve cell, it can become a bone cell, it can become a skin cell. So those are stem cells. So stem cell therapy would be very helpful for patients who have chronic kidney disease, patients who had undergone multiple cycles of chemotherapy and their bone marrow was, destroyed so much already. Stem cell therapy can help you. Also, but this is still, I don't know if this one is still in the clinical trials or they're already doing this. Diabetic patients who have pancreatic insufficiency anymore, so they're not producing so much insulin anymore. So stem cell therapy, we can give stem cells to these patients so that their pancreas can regenerate. Okay, the same is also true for liver patients who have liver cirrhosis. Okay, so yeah, those are just some of the applications. So some applications are already being done inside hospitals. Some are, I don't know. I think they're still in the experimental stages, no? But soon probably we can find these types of applications more common in the future. Yep.
Hopefully. Okay. So moving on to the next question. What is the difference between immunotherapy and chemotherapy?
Okay, immunotherapy and chemotherapy. Chemotherapy is cytotoxic. So meaning the chemotherapy drug itself will kill the cancer cell. Okay, so that is chemotherapy. So by its name, chemo, chemical. So it's a chemical therapy. Okay, it directly kills the cancer cells. Now, immunotherapy is different. So immunotherapy, there are different kinds of immunotherapy. Okay, so it's ICI, the one that we discussed earlier, immune checkpoint inhibitor is just one. Okay, so for immunotherapy, these drugs utilize your immune system to kill the cancer cell. Okay, so we get it now. So one is direct. How do I? Okay. Number one is, the killer itself directly killing the victim, the cancer cell. The other one is a mastermind telling its accomplice, the immune system, to kill the cancer cell, to kill the victim. Okay, so that's how that's one of the difference of chemotherapy and immunotherapy. And also there quite starking difference also, when it comes to their side effect profile. Usually chemotherapy side effects are much more heavy on the body, whereas immunotherapy side effects are much more tolerable. Okay? Yeah.
Thank you, Doc. Okay, I'd also like to acknowledge one of our avid viewers, Ma'am Nessie Ocampo, who has a question for us tonight. So, Doc, I have an autoimmune disorder, scleroderma, and my lungs had a scar. Should I continue PPARs? I already had taken PPARs last 2019. I took PPARs powder for 2 months, and I regained my strength. My cough stopped, and I can breathe more easily.
Yeah, I think it would be good if you can continue, since you've responded well to the PPAR agonist. So, but this is already 2019, so it has been 4 years already, 3 to 4 years, right? So I advise you to go for a consult so I can make the proper protocol recommendation. Okay.
So, thank you, Doc. Next question: is immunotherapy suitable on all types of cancer?
That is the question that the medical community is trying to answer right now. Okay, so hopefully, immunotherapy is really very, very, very promising. And let's pray that immunotherapy can be a very good tool for us to use on all types of cancers. However, the question would be, will it be feasible or will it be realistic to say so? Well, I think at this point in time, it will not. It would still be a long way, a long road ahead, because there are certain cancers that are so rare, okay, that not a lot of people in the globe, in the whole world that has it. So when it comes to immunotherapy or drug clinical trials, we really need a lot of patients to go on these trials so that we can know how effective it will be for them. Okay, so so I think because of that, realistically speaking, I think it would be a very long road ahead. But at least for the more common types of cancers like your lung, colorectal, breast, prostate cancers, immune checkpoint or immunotherapy would really be a mainstay treatment. At least in this decade, I believe so. Okay.
Okay, thank you, Doc. Another hopeful question. So, next, moving on to question of Miss Cheryl. I had water drained from my lungs. Can I still take PPARs?
Yes, I've had patients who have done so. So I've had a stage 4 breast cancer patient who have bone metastasis and lung metastasis. So this patient of mine suddenly developed difficulty of breathing, or not really difficulty of breathing. No, it's more of shortness of breath, okay, and easy fatigability. So when she reported this to me, I immediately requested for an X-ray, and lo and behold, the left side of her lung was already filled up with water or filled up with fluid. So immediately, this patient went to the hospital to have the water in her lungs drained. So after draining, then they went for a scan, and yes, there was really a lung metastasis. However, this patient of mine underwent chemotherapy again, But of course, together with PPAR agonists as well, we combine them. So eventually, the patient finished the short course chemotherapy again. The fluid in her lungs resolved, and there is no recurrence anymore. Yeah, because this is actually an amazing thing, no? Because pleural effusion or water inside the lungs, when it happens to cancer patients, number one, the prognosis is bad, really bad. Number two, usually it just goes back. Yeah. Okay. So this is really a very good response for my patients, and we're really glad that she was able to survive. Okay.
Wow. So praise God, and please continue your healthy diet and lifestyle, ma'am. Okay, next question from Miss Mary Ann Gantala. How about osteoid osteoma?
Osteoid osteoma, okay, that is a rare type of cancer, no? But what about osteoid osteoma do you want to ask about?
Okay, okay, maybe if PPARs can help with it.
Okay.
Let's see.
Osteoid osteoma is a benign tumor, no? By its name, no? Osteoma. Osteoma is a bone, is a tumor located on the bone. Now, for these types of tumors, no, we can, again, this is rare, no? So the studies regarding PPAR agonists and osteoid osteoma are not a lot. Okay, so when it comes to efficacy, that would still be a question mark. Okay, but nonetheless, since Simply Nature PPAR agonists supplements are food grade anyway, so we can try and test it out if it works. So yeah, but in the most fundamental form of, or fundamentally, Simply Nature PPAR agonists, the way it works would still work on osteoid osteoma, because PPAR agonists work this way. So they act on the genes so that the tumor suppressor genes, or the genes that is stopping the cells from, or the genes tumor suppressor genes that or the genes that controls or regulates the the cells multiplying, they become turned on. Okay, they become active again, so that the cells will stop replicating. Okay, also the oncogenes, no, that we have, that the genes that pushes for the cells to multiply, they get turned off. So the end product would be apoptosis. Okay, so in its fundamental function, PPAR agonist should help. Okay, but because osteoid osteoma is very rare, which is not many people have it. So the studies for this, or the research about this, is really quite few. So the outcome would still be, I cannot really say if this will work or not. Okay, but nevertheless, you can try and see if it works. Okay, to know the proper protocol for this, no, I need more information. So please go for a consult so I can make the proper recommendation or the proper protocol. Okay.
Okay, Doc. So she has a follow-up question. Can it become cancer? It's found in a right leg of a 9-year-old boy.
Okay. Will it become cancer? Yes, there's a possibility, because you are in the patient is in the age group where osteosarcoma occurs. Okay, osteosarcoma is the cancer form of osteoma. Okay, so there's a possibility. Okay, yeah.
Okay, another follow-up question regarding the pleural effusion. So, is there a possibility that it will come back?
Yes, usually for cancer patients who have pleural effusion, it's really very troublesome. No, so usually patients go home with a tube sticking out of their chest, no, which is really very unfortunate, because they cannot remove the tube because the fluid just keeps on coming back. It's a very problematic thing to happen or a very problematic complication for cancer patients. Okay? Yeah. So there's a big possibility that it will go back. Okay? So really, if you are someone who have pleural effusion, very important to go for the recommendations that your onco tells you to undergo. Please consider PPAR agonist therapy because it really can help. Okay.
Okay. Thank you, Doc. Next question coming from Miss Annie Dayan. I have a lump on my breast and the biopsy said it's suspicious malignancy. So,
yeah, I need to know what you're asking about it. So,
okay, maybe, okay. So, what are the tests she can do to confirm it?
Okay, so tests to do to confirm it. Well, you have already underwent biopsy, no? And if it's suspicious malignancy, so meaning the biopsy result is still questionable. Okay, so if it's like this, one of but here are a few things that can be done. No, repeat the biopsy. Okay. Number 2, remove the mass altogether. And if we remove the mass, no, or the procedure to find out the appropriate procedure to remove the mass, it's very important to find out if there are lymph nodes that are already involved. So imaging studies should be done, like your CT scan, a repeat ultrasound. Those imaging studies has to be done. Okay. Well, if it were me, I would recommend probably a CT scan with contrast to give me more information. But yeah, please go for a consult so I can make the appropriate recommendations because questions.
Okay, so again, for those of you who wish to have a consult with Dr. Jansen, the link to schedule an appointment is in the description box below, or just comment how to consult and they will reach out to you shortly. Okay, next question coming from Arceli Ocampo. Is organic meat okay or eggs for cancer patients?
Okay, no. Again, animal food products or animal protein can make your cancer worse. Okay, so don't eat any foods that has animal protein in it. The body will not be able to recognize if it's organic or non-organic. If the animal that you just ate have scales or no scales. If it's animal protein, that will help your cancer grow further. Okay, so regardless. Okay, so no meats, no eggs for cancer patients. Okay.
Sorry, guys. Okay. Next question coming from Sir Reinbert. How long can a patient be under immunotherapy? Is it safer than chemotherapy?
Oh, as long as possible. Okay. For immunotherapy, the things when do we know to stop giving immunotherapy? Number 1, if the cancer or if the tumor is completely gone, okay, then that's the time to stop. Number 2, if the patient develops adverse reactions. So adverse reactions that are quite severe. Okay, so we have a grading system and we have a system that we use to know if this reaction that the patient experienced is bad. Okay, so if we see these symptoms or if we see these signs, then this is the time. This is when we need to stop giving. We need to stop immunotherapy. But as long as the patient is responding, or the patient is not does not have any adverse effects, then you can continue giving immunotherapy. Okay, so I'll just give you an example. No? So one type of immunotherapy called atezolizumab can be given for life. Okay, another one like pembrolizumab, also the same. No, it can be given for life or it can be given for at least 1 year. Okay, so those that's the time frame of giving immunotherapy. Okay, some are actually even one dose shot only. Okay, but that's another type of immunotherapy. Okay, so yeah, there you go.
Okay, moving on to another question about immunotherapy. how long does a patient have to wait to feel the effect of immunotherapy?
Oh, it depends. No? It varies patient to patient. Some patients immediately feel side effects on the first dose. Okay. Some patients actually don't feel anything until until 6 months later. Okay. And some patients don't even feel any side effects at all. So it really varies. It really varies. Okay. Yeah.
Okay. And what are the different types of immunotherapy treatment? Is it always oral?
No, immunotherapy treatment are IV treatments or injected to your body. Okay, I don't think there are any oral immunotherapy treatments available.
Okay, thank you, Doc.
Yeah.
More question about immunotherapy. Does immunotherapy have side effects?
Yes. Oh, so if you want to know the side effects of immunotherapy, just go back to the video that we've, just go back to the webinar that we've done a while ago. So just pause. There's a table that I've shown there. No, that table shows all the side effects that we can expect from receiving immune checkpoint inhibitors. So yeah, there's actually quite a lot.
Okay, Doc. Coming back for that 9-year-old boy with osteo. I want to ask about it. What is it and what's the usual cause?
It's genetic. Okay, it's genetic in origin. Yeah.
Thank you, Doc. And back to immunotherapy. Is immunotherapy can be combined with other treatments coming from Grace?
Can it be combined with other treatments? Yes. So PPAR agonist therapy is one of them. Other treatments like chemotherapy, yes. Actually, some oncos do chemo first, then immunotherapy next. Okay. Yeah. Absolutely, yes. It can be combined with a lot of different treatment protocols for cancer. Actually, I've attended this virtual conference, no. I think this was held in. I think it was held in France. I'm not sure, but one of the advocacies that they kept coming up, that's repeatedly discussed in the conference is the cancer treatment should not be monotherapy. So meaning, cancer treatment should not be focused on one drug or one mode of therapy alone. It should be a combination of different cancer therapy modalities. So, for a cancer patient, you can have chemotherapy, multiple chemotherapeutic drugs. You can also have natural treatments. For example, your lifestyle prescriptions, intensive lifestyle interventions, your supplements. Okay. Another one would be your immunotherapy. Okay. So these things have to be combined in order to give the patient the best outcome. Okay. And true enough, actually in my readings, in order to capecitabine or an oral chemotherapy drug can make the PPAR therapy more effective, and also the PPAR agonist therapy can make the effects of capecitabine more effective in killing cancer. Okay, and the beautiful thing about that is when you are undergoing capecitabine therapy and you're on PPAR agonist therapy, your side effect because of the capecitabine therapy is also blunted. Okay, because of the innate anti-inflammatory properties of the PPAR agonist therapy. So it really works hand in hand. Okay, so that's actually the beauty of it.
Nice. So, speaking of cancer protocols, a question from Miss Christine. Doc, what do you recommend? Take out the tumor first, then biopsy, or chemotherapy first and then surgery to take off the tumor?
The short answer to your question is it depends. Okay? To what will it depend? The size of the tumor and the stage of the cancer. So, in order for me to make the appropriate recommendation, please go for a consult because I need more details. Okay?
Okay, so back to immunotherapy. Is there a way to be more sensitive to immunotherapy? Or will the effect be lessened for patients undergoing chemotherapy?
Yeah, very good question. So, right, when you undergo chemotherapy, right, your immune system will go down. Then, if your immune system goes down, if you give immunotherapy, will it not lessen its effectiveness? Yes, that's true. So that's why you have to space it out. Okay. So before we give immunotherapy to the cancer patient who have finished chemotherapy, it's very important to rehabilitate the patient first. Okay. So make sure at least the blood cell counts or the white blood cell counts of the patient should be in the normal range. Okay. So if it's in the normal range already, then we can already begin giving the patient immunotherapy. And of course, dietary factors, no? A plant-based diet is really very important to make the immunotherapy more effective. Okay? Yeah.
So more question about immunotherapy. Can a person be immune from taking immunotherapy treatment?
Okay, by that, I think you mean resistant. Okay, so that is a very good question. So at this point in time, we still do not know if there is such a thing as a resistance to immunotherapy, but we know that we have non-responders. Okay, but being immune to it, or previously it works, then suddenly it doesn't work anymore. It's not really your body resisting the effects of the immunotherapy because you are less sensitive, no? It's just because, number one, the cancer might have evolved or might have mutated so that the immunotherapy that is being given is not effective anymore. Or another one would be, you're not responding. It's the wrong drug. Okay? So, yeah, those things have to be taken into consideration. Okay?
Okay, so more questions are coming in. So next question coming from Mr. Mario. Is it safe to take spirulina with probiotics for patient with invasive breast carcinoma grade 2?
Yes, I think it's really very safe. No, I mean spirulina is a microalgae that is very commonly eaten by a lot of people. Even healthy people don't feel any adverse events from it, except for some rare side effects like brain fog. Probiotics can really help, especially in making your immune system strong. No? So yeah, it's really safe to take microalgae like spirulina and probiotics in cancer patients.
Okay, so it looks like we've covered all our questions.
Wow, wonderful. A lot of good questions tonight.
Okay, so again, for those of you who wish to have a consult with Dr. Jansen, the link to schedule an appointment is in the description box down below, or you can comment how to consult, and the healthcare specialist Beth will reach out to you. So just before we say goodbye, kindly give our viewers your parting words for tonight, Doc.
Yeah, so we've discussed immunotherapy. We've finished the 3-part series or the 3 video series for immunotherapy. So immunotherapy is really one of the novel cancer treatments that we have right now. So let's pray that it becomes a big success, so that we can really win against the fight against cancer finally. So yeah, thank you for attending the webinar. Next week, we would be talking about, next week I think is the World Cancer Day, right?
Yes.
So, yeah, so we're going to talk about how or whether or not does sugar really feed the cancer cell, and the effects of sugar in cancer growth. So please stay tuned. Okay? Yeah.
So thank you once again for watching Simply Healed webinar. We hope to see you in all our future webinars to come. Same day, same time, every Thursday night at 7:30 p.m. And that's, as Doc said, our next webinar will be entitled Does Sugar Feed Cancer? So this is in line with World Cancer Day. And for our dearest clients in the Philippines, starting tomorrow, you can check out Cleansing Plus, your daily essential fibers, via Lazada Sulit Sweldo sale. So, until January 31, when you can catch me again during the Lazada Live by 3 p.m. with a very special guest. So, clue, he's tall, dark, and handsome. And the name starts with letter R. If you can guess the name, comment down below. He will be giving out a free sachet of Cleansing Plus for every order checkout during the Lazada Live. Moving on, your curiosity about your health condition and your victory over cancer is what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thank you everyone, good night, and God bless you all.